And the other thing.
There we go.
Welcome, everybody, to the December Hot Topics from the League of Women Voters. And hope everybody's in the holiday spirit. And this month, we will be this month, Doug Adair from the Nashville Diaper Connection is going to be presenting to the group. So I know Doug because he's married to an absolutely fabulous woman who is my friend. And so he has great taste. And he's done some absolutely wonderful stuff in his life. He'll tell you about that maybe before he was in finance and such. And then in 2013, he opened up his garage to chunk of stuff called diapers. And he'll tell you more about that. And he'll tell you about the Diaper Connection and its connection to lots of things here in Tennessee, which we were just talking about. And I'm sure he'll repeat it for all of us here. So it is December. Welcome, everybody. I understand it's kind of a, it's a month where it's difficult to get everything in. And we have not got a hot topic yet decided upon for January, but rest assured, there will be a hot topic in January, even in the coldest of, I guess it could be the coldest of month, although February might be colder. Anyway, with all that, whatever I've just said over, I'm going to pass it over to Doug. So Doug, please be my guest.
May I share my screen? Well, thank you, Karen and Melissa and Laura, for inviting me to represent Nashville Diaper Connection with the League of Women Voters in Nashville. I really appreciate the opportunity to visit with y'all. What we have is Nashville Diaper Connection is Nashville's only diaper bank. I'm wondering if y'all could raise your hand via Zoom and tell me how many of you knew what a diaper bank was. You just get some sense of who had ever heard of a diaper bank before. Well, thank you. A diaper bank is very much like a food bank, except we only do diapers. And Karen had already given me a good entree and an introduction. Why diapers, right? Why diapers? Nashville Diaper Connection exists to make sure that every baby has a chance for a healthy start. And I didn't know anything about this. These are the things I want to share with you today. Back in late 2012, I didn't know what diaper need was. I knew that babies needed diapers, right? But it'd been a long time since I'd changed a diaper because, like today, my youngest is 24 years old. So it'd been a while. I was at a social justice series at my church. The executive director, one of our leading nonprofits, made a pitch. I said, okay, you got me. And what can I do to help? I call that the second most expensive question I ask, right? What can I do to help? And he proceeds to say, are you serious? I said, absolutely. He said, get me some diapers. And I said, no problem. And then only after I had committed did I ask him why diapers. And he proceeded to tell me that through their food pantry, diapers were the #1 request that they got. And then he told me how hard it was to get them. And I said, no problem. I got you covered. Then I started to do some research into it. And you know what? It's a big problem. It's a real big problem. I thought I could just make a few phone calls, and that did not turn out. So talked to my wife, and even though she thought I'd lost my mind, she said, great, we have to do something. Cleared out a corner in the garage and started buying diapers. this is the outcome. What I'm showing you today is what I hope to get across to you today as to what I learned after making that commitment. Um, Diaper need is a huge public health problem. And we wanted to address that problem. It is a tremendous equity problem. It is, in many cases, geographically specific structural racism with the difficulty it has for people of color to be able to access a basic need. So Nashville Diaper Connection is working to try to change that. My wife had the great sense to say, we're not going to give them out directly because she didn't want people coming to our house 24 hours a day, 7 days a week, trying to find diapers. And as Karen alluded to, I was an institutional mortgage banker for 41 years before I became a diaper banker. So we set up NashDiaper to use the few strengths I have, which was setting up institutional relationships. So we set up a network of partners. And as you see, we've been successful in building that network. And in order to do this, the last thing that I want you to take with you is in order to do it, we need dollars, we need doers, we need diapers if we're going to continue doing what we do. First, the effect on lack of diapers, diaper need effect on the child. These are not hypotheses. These impacts are the review of a pretty significant body of peer-reviewed research led by a number of institutions, including Duke, Yale, University of Connecticut, and others that have documented what the impact of a child is of spending too much time in a dirty or wet diaper. Profound impacts, far more than you would immediately assume. And it has effects on the family beyond just the child. Many of you may or may not know, but in order to leave your child at daycare, you have to leave a day's worth of diapers. So if you do not have the diapers to leave, you can't leave your baby. So no diapers, no daycare. No daycare, no work, no school. You lose a paycheck, lose that day's worth of wages, and you don't get your money back from daycare, which, given the cost of daycare today, is a pretty substantial investment. So that just perpetuates a broken cycle that it is not set up to support parents with young children. You can't pay for diapers with WIC. And give a shout out to Laura for letting me know and informing me that she learned that you can't buy diapers with SNAP through an M&M song. And I'm going to add that to the body of knowledge for the National Diaper Bank Network today. And I appreciate that. I'll make sure that the League of Women Voters Nashville gets credit for that information share. So this cycle, there are no federal, state, or local safety nets for diapers. Well, there is a local safety net now because that's Nashville Diaper Connection. Our goal is to end diaper need in Nashville. We got started giving away diapers out of my garage in 2013. Photograph on the left was the first time I met Laura Little. That was back in 2014, and Laura went on to help us deliver diapers until 2018. National Diaper Connection in the beginning was a 100% volunteer organization. We didn't get our first employee until July of 2018. I became employee number 2 in 2019. And the photograph on the right is a recent birthday picture. We just turned 10 years old. We turned 10 years old in June the 4th. And that 10 has double meaning for us because on July the 7th, Nashville Diaper Connection delivered its 10 millionth diaper. And now as of today, we've delivered over 11.5 million diapers. We serve about 4,600 babies every month. And we have gone beyond Nashville and now serve from the Kentucky border. We are on Fort Campbell, providing diapers to our service members to the YMCA's food pantry. And given that I'm talking to politically engaged women, I want to throw my opinion out there that it is fundamentally wrong that any of our service members need either A, a food pantry, or B, supplemental diapers. Now, I'll exit the soapbox for just a minute. That first year that we did diapers, we gave away 19,000 diapers. I thought I'd cured the common cold. Now, and we served that whole year, we served 380 children. Like I show you here, we're serving 4,600 babies every month. We help diaper 225 diapers, 225 babies every working day. The way it works is we raise money, we get donations of diapers. We have our volunteers come in and repackage the diapers into packs of 25. We provide 50 diapers per child per month, and having them in packs of 25 keeps it consistent, keeps that everybody gets the same thing. We then distribute it to our partner agencies, the people who actually put the diapers in the hands of the parents. And today, we have 79 of those partner agencies. When I started NashDiaper, when I was doing the research, Tennessee 211, and when I called them to do the research, said that there were 2 places to get diapers, right, in Nashville. I called them. One of them was closed, and the other one would put you on a waiting list for 6 weeks. Then they'd give you 50 diapers. Then you had to wait 4 months to get back on that waiting list. And any of y'all that have had kids or have taken care of kids, babies go through a lot more diapers than 50 diapers in a 5-month period. So we set up that partner agency network. The partners get the diapers to the families, and that takes a little bit of stress off for the moms. Some of the partners that we have in the greater Nashville area are names that you probably recognize. We know that we're not experts on adoption. We know that we're not a home visitor like Nurses for Newborns. We don't, we're definitely not doulas. But we partner with agencies who have a close relationship with families, particularly mothers with very young children, who can help that mother, that parent, get things beyond diapers. If they need diapers, more than likely they need something else. Number one. Number two, it is a requirement of our becoming a partner of National Diaper Connection that a parent can get at least 2 things with every visit to our partner agency. 1, diapers, of course, that is our sole focus. But 2, whether it's visiting an emergency food pantry, accessing the resources and the support from the domestic abuse for victims with the YWCA, the host of services that Catholic Charities or Martha O'Brien opens, but they're able to get 2 because we've learned that the only thing that a struggling mom has less of than money is time. So we want them to be able to maximize, the time that they have, spend it with their children, take a breath, just get a little bit of relief. So we are very proud of the partner network that we've built. In addition to the partner network, we've got 2 nationally recognized programs that I am so very proud of. One is our Diapers for Diplomas program. Parenting students are an overlooked part of the post-secondary education system. The studies have shown that they feel seen, that they don't fit in. And they really have a struggle because, just frankly, college is designed for kids coming right out of high school, not for a parent trying to re-enter the education system so that they can, finish their education. So what we do is for any of the 4 community colleges in Middle Tennessee and soon to be colleges, Tennessee Colleges of Applied Technology, we will, if a parent is enrolled in one of those schools, we will provide 100% of the diapers that family needs for a full academic year. That's pretty amazing. Yes, I'll break myself arm patting myself on the back, but where this is the only program of its kind in the country, we've provided 289 of these scholarships to date. We're in all 4 community colleges in Middle Tennessee, all 16 campuses. And one of the things I'm really proud of is of the scholars in our first 2 cohorts. We're in our 3rd cohort now, but in cohort 1 and cohort 2, 77% of our scholarship recipients either completed their the academic year for which they received the scholarship, or they graduated. If you compare that with 2 things, 61% graduation for Tennessee Reconnect students that targets adult learners, or 46% persistence in graduation rate for a single month. And nearly 1/3 of our scholars are single women raising kids alone. I'm really proud of that. The next program that I'm awful proud of is our Connections program. And when we started doing research on Connections back in 2018, Tennessee was 47th in the nation in terms of infant and maternal health. It has currently rocketed all the way up to 42nd in the nation. So it ain't so great. But we designed the program to where we could reach mothers, and I'll say moms and parents. 93% of the time, the diapers go to a woman, whether it's a mother, a grandparent, a aunt that is helping taking care of the child, or 93% of the time it's a woman. We want to get our diapers into where mothers are. They're getting care for their children. We want to reward that behavior. We want to report repeat engagement, because every time a mom takes their baby for a well child visit, or a required immunization, or the mom gets a well woman visit, mom gets a flu shot, the dad gets a flu shot, dad gets a COVID vaccine, an elder sibling gets their back to school physical, they're eligible to get 50 free diapers. So what that's doing is that's helping cement a relationship between the parent and the providers. And today, I'm really, really proud to say that we're up to 36 clinics in Middle Tennessee that are participating in our program. We've engaged with over 50,000 families, and to date, since September of 2020, we have facilitated now almost 29,000 well child visits, and that's a pretty significant improvement. I've told you about a couple of our programs, our key programs, and I've told you generally what the diaper bank does. Our job is to put diapers on butts, right? From Kentucky all the way down to Alabama. And to do that, we need 3 things, right? We need dollars, we need doers, and we need diapers. Dollars, we buy 90% of the diapers that we provide, and this year we will provide almost 3 million diapers across our partner network, our scholarship program, and our clinics. 3 million diapers. I'm going to use a technical term in the diaper banking world. That's a lot. We need, like I said, we buy 90% of it. It costs, just a good rule of thumb is it's $400,000 per million is what it costs to get a diaper out the door. So that's the dollars. We need doers. We repackage 100% of the diapers that we distribute in the community. As I said, so that we're distributing an equal amount for each family. We also need to break them. We buy our diapers directly from manufacturers, and we have to get them out of retail branding for, again, the consistency, but second, to keep them from being resold once we've given the diapers away. Some of our diapers ultimately do get resold, but it's much, much harder to do that. So in order to make that happen, we absolutely have to have volunteers. And we love our volunteers. We've got a great dedicated space for it in our facility. Fact is, our volunteer space is by far and away the most attractive part of Nashville Diaper Connection. And they have a great time. And I want to encourage you to please consider getting involved with us as a volunteer. If we got the dollars and we got the doers, we can put diapers out into the community on a consistent basis. Like I said, there used to be only one place. I'm very happy to tell you that one place that had the 6-week waiting list, they don't have a waiting list anymore. And they distribute over 100,000 diapers a year, and all those diapers come through National Diaper Connection. And what you see here is the kids that we have engaged with and helped. This is on the upper left is our partnership with Connecting Kindness, which is an amazing organization that I can't begin to say enough good things about the work Donna Pack does. In the upper center is Heidi Hain, our program manager, and Barthena Mesa out in that appears to be MDHA's property in South Nashville. These kids are in Harry Pediatrics. This beautiful young child with the orange is in Neighborhood Health in Madison. This bruiser right here is standing next to some of our diaper inventory. And this beautiful child right here is another Meharry Medical Clinic patient and was featured in our first annual Connections calendar. We're proud of that. So diapers make a difference. And we are right now in the middle of our annual fund drive. And the fund drive is give a little, change a lot. We're trying to raise $50,000. They would take away my nonprofit license if I didn't ask you for money. So here I am. You have, please scan this code, give early, give often, and share it with your friends. That's my pitch, Carl. What, Melissa, Laura, can I answer any questions?
We have one question that I think is the basic question about why is it the case that you have to do this and diapers are not part of all of the various programs for folks who are mothers, etc.
I wish I had a satisfactory answer for you, Karin. The fact is, there is no really good answer. The fact that they're not included in WIC, Women, Infant, and Children vouchers, that's part run by the U.S. Department of Agriculture, and our SNAP or food stamp benefits, is both programs are woefully underfunded, particularly WIC. WIC is a nutrition supplement that's available to pregnant women and on through the first full year of a child's life. Provides really important access and help with key nutrient things necessary for a healthy diet. It's underfunded. I mean, it's tied up right now in the Farm Bill. So there have been proposals recently to reduce the amount of funds available to WIC, And presently in the state of Tennessee, only 42% of the people who are eligible are accessing WIC. There needs to be an overhaul of how it's accessed. There needs to be an overhaul in how it's promoted. I can't answer why other than no funding for the Department of Agriculture for that. Food stamps, similar situation. SNAP is constantly under fire when anybody looks at the budget. And if people think that it's particularly a luxury or a support to quote welfare queens, I think the food benefit is now up to like $1.62 per person per meal. I cook for our families, and there's no way in hell I could feed me, my wife, and my daughter for a little over $4.50 a meal. And I have a bunch of resources, and we have fortunate to have a little bit of time where I could pursue it. The people we serve don't, right? So, and most of the people, 92% of the people that we are helping, they're working at least one job. And we were talking about the Governor Lee's proposal to have TennCare provide a diaper benefit for approximately half of the diapers that a child 0 to 2 needs. That is a magnificent idea. It'll be wonderful once it gets off the ground, which will be sometime next year, if we can get the word out. I'm very, very grateful for the budget that was approved, but it's not nearly enough. We're still going to have, I'll speak to the research I've shown that I've done and I've seen says we're going to have over 50,000 babies in Tennessee that will not be able to access that benefit from TennCare. And it doesn't, babies got to have diapers. Diapers make a difference. And we proved it through our connections program that we can improve quality metrics around well child visits, immunizations, postpartum depression screenings. Diapers make a difference.
So I believe that what you're mentioning, and Melissa added it to the chat, is that last year, some amount of money went in to support diapers on TennCare.
Yes.
And I think what you said, and I don't think we also, just so, I mean, you and we talked about it before you got on, but that has been supported by CMS because TennCare is a separate Medicaid program that Tennessee has. And so they have to get special dispensation from CMS for various things that they add. So CMS in general does not support Medicaid programs adding diapers to their in general, because we have to. Right.
That is correct.
Right. So we're attempting. Do you know of any other states that have been able to put diapers into their Medicaid / programs that they have?
None. I can tell you that Connecticut is working on it. I do not believe that Connecticut is nearly as far along as we are. There's been, I believe, Massachusetts has also begun a study of their Medicaid program to see if they could incorporate it. The reason we were able to do it is the Tennessee requested and received a block grant, changing the underlying funding structure for TennCare, our Medicaid agency. And so the $30 million that TennCare received was part of a refund that the state of Tennessee received from the block grant savings in its first year. So we expect that to continue. I can't tell you that the TennCare diaper benefit will in fact continue, because that has to be renewed by our state legislature every year.
And so was it the first year that it was put in, this last one?
Yes, ma'am. It is not in place yet. It was funded in last year's budget. Uh, the Tennessee Diaper Banks, led by Nashville Diaper Connection, have been very much involved in advocating with CMS, with TennCare, and with federal legislatures to weigh in and support the request of CMS. Our fingers are crossed, but there's no guarantee that they're going to approve it. It would open a floodgate of the other 49 states asking for a diaper benefit.
Right, right. So basically, CMS also, I mean, it's one thing for the Department of Agriculture to decide that they don't want to put to put diapers on butts because they'd rather put stuff that makes the stuff that requires diapers on butts. But it is not appropriate, it seems to me, that CMS doesn't see this as part of what it means to, to raise a child, to raise a healthy child. So it seems more likely, and this is remember, this is all, take this all with a grain of salt because this is Karin, but it seems more likely and rational to go through CMS to say that this is part of what it means to raise a healthy baby. This is healthy baby stuff. This is what Medicaid, this is what we want for healthy babies. And we, that would be the place. And then Tennessee sounds like it's, even though Connecticut and Massachusetts is there, or starting to be there, Tennessee has already put themselves into a position of, we want to put this into our TennCare program. So we're actually ahead of we're actually number one. One could argue.
That is correct. That is absolutely correct, Karin.
And that's actually cool. I mean,
and I think, again, as a group of politically active women, I think you need to let your legislators, I would ask that you need to let your legislators know that you appreciate that. One other little tidbit, in addition to fundamental equity and absolute fairness, it is, babies need diapers, right? I can give you all type of background as to why, the health reasons, the early childhood development, even early childhood literacy. But let me give you one more big argument that they will listen to. Anybody got any idea on what TennCare spends on diaper rash, just diaper rash alone per year? This is a 100% or 99.9% preventable illness. We spend almost $10 million a year. This is based on public data that I requested from TennCare. That doesn't include UTIs. That doesn't include the service provided at where the diaper rash is treated. That's just diaper rash. So we're going to be able to recover a meaningful percentage of what we spend, and we're going to have healthier, drier, happier babies. So to me, that's a win-win.
Doug, could you clarify for us, back to the question of, Tennessee including the $30 million in a new program for diapers? This is actually, is this true that this is based on the money from the block grant, because we have not expanded Medicaid according to the federal eligibility rules. So we're really, the pots keep getting shifted about where money is. And, so I kind of think like this is a bait and switch on, oh, hey, we're doing this great thing, which is a great thing, but it's also at the detriment of a much larger issue.
I agree with
expanded care.
I agree with you 120%. I will tell you, this is not probably politically astute of me to point this out, but when TennCare made this request, and when the legislature funded this pilot program, they increased the income eligibility for pregnant women up to 250% of federal poverty level from the prior 100% of the federal poverty level. So it broadened the net of women that can be cared for by TennCare when they're pregnant. And as a result of that, that baby being born on TennCare has a year, right? So that was sort of a stealth way of expanding Medicaid in Tennessee. Nobody's going to admit that. And I ask you not to rock the boat because babies need the diapers, moms need the help. But it was really smart, right? Really, you had these folks that are, pounding on their lecterns about what they pound on, getting credit for some funding that was ours through a Medicaid savings program, which they don't want to expand. So go figure. If you figure that one out, Melissa, I would really, really like you to share it with
We have,
me.
I mean, you can't even, you don't even.
Karen and I have great plans.
But I mean, the League of Women Voters, and I mean, since forever, from the very get-go with the ACA and Medicaid, I mean, even Haslam. I mean, I'm just saying, it's like it's been around for a while. So I'm just saying, whatever decision people have had vis-a-vis this, or why, seems like it's pretty entrenched. There are, by the way, for those who are on who would like to ask questions, please feel free to unmute yourself and ask a question if you don't want to type it in. I see that there are some people reacting, but for some reason my reactions aren't working. Oh, there it is. Good Lord. Look at that. It is working now. Okay. So if anybody else, is there anyone else who has any questions out there? Otherwise, what happens with these things is that Karen and Melissa will pepper the poor guy with lots. And so, of course, Melissa and Karen are always involved in trying to solve these things, or pointing to other people who are like, well, what about, so since I don't see anybody, I will ask. So I believe what you've said is that that went into the legislature put in monies for TennCare for this coming year, which may or may not get accepted by CMS. In some ways, by Tennessee doing this and CMS approving it, it would be the first pointing out that Tennessee, even though we haven't expanded Medicaid expansion, and Wisconsin hasn't either. There are other places that have not done this expansion. They will, every one of them, regardless of whether they are expanded, are going to be, Tennessee will show that none of them support diapers. These things do not support women getting diapers for their children, for their babies. And, the number you just gave, with $10 million spent every year dealing with diaper rash just in Tennessee. So it is a way to, sort of goad something into change, regardless of whether we're able to actually use this to expand. Actually, it doesn't help. Use this to expand Medicaid in Tennessee, which we're all very supportive of. It will not detract from that. It will not detract from that project that we are involved in. You are involved in, we are all involved in. I know that was maybe not the most clear statement of things, but yeah. So I guess
we'll have at least, remember, the TennCare thing, if it gets funded, is only going to cover 1/2 of the diapers needed for these kids.
Right. So
that's if 100% of those moms are able to sign up. Two, that it's going to leave at least 50,000 kids that still need diapers uncovered. So while we're super excited and so grateful to those forward-thinking folks at TennCare and for the legislatures for funding it, it took their $30 million, our $30 million, not their $30 million, but there's let's put it this way. I have Nashville Diaper Connection is going to be a needed resource in Nashville and Middle Tennessee for some time to come.
Yeah, right. And so that the next thing that will happen is in this coming session, there are two things that, one, the CMS has to make a determination about whether this program is going to be allowed in TennCare, correct? Okay, one. Then two, if it is allowed, then it has to be funded by the legislature every fiscal year.
Yes.
So then we will need to ensure that it gets adequately funded or expanded. In this case, it's not even starting out adequately funded every time the budget comes in every year. So that will be a thing that once if it's agreed to, then there still is oomph that needs to be pushed, done for them to continue to support it and to expand it.
Yes. And if you will follow us on social media, generally our handles are NashDiaper Bank, or go to our website, which is Nashville, www.nashvillediaperconnection.org. You can keep up with the progress of those things. I'll make a point that we have that on there. And as Pat just asked, and I'm very grateful for her that she asked, where do you go to volunteer?
Yeah.
Great question. And our Barthena Mesa, our volunteer coordinator, would have hit me, Pat, if you hadn't asked that question. Go to our website. We have a tab that says Get Involved. It'll tell you about the volunteering process, and follow a link on that page to a calendar where you can pick time for you and your friends to get involved through volunteering. We also encourage companies. It's a great team building effort. Churches have been super volunteer supporters, schools, social organizations. We have posted volunteer opportunities every week, and it would be love to talk to you about getting your company, your church, your school on the calendar to come in and help us leave no child left behind in Nashville.
Well, Melissa, this has been fantastic, Doug. Any other questions out there? Anybody? Or Melissa?
Well, it's certainly been very informative, and we can, as part of our process, Doug, we always do a write-up of our hot topic, and we'll post these links and give people the opportunities to I encourage everyone, because the voter won't be out until later in the month. Year end is a great time to spread the gifts of of generosity and dollars to whatever organizations you prefer, those on the call. This is one of them that your dollars might have, significant, tangible, immediate results for. So consider that when you think about where you want to make your mark. And I know that the place that I work, we do volunteer activities as teams on a quarterly basis. So I am going to make sure that the Nashville Diaper Connection is one of those options to choose from to help with that repackaging and get my company on board with this. So if you work at a place or have other groups that you're involved with, organizing a volunteer day is a really gratifying kind of experience for all of us too in these troubling times that we find ourselves in. And so, giving to our communities and those where we can see, the really immediate results is a very special experience for everyone.
And if y'all want to do something as the league in Nashville, I will gladly open the doors and welcome you with open arms. And it's really kind of fun. I mean, remember, I think more about diapers than any guy my age, that's not wearing them. Yeah. But it's we're told that it's fun. So we would love to have you.
Great.
Well,
I think
thank
both
you
of
so much, Doug. And Melissa, as always, it's great to have you follow up my, you're just great at this. Anyway, again, thank you again. And for those of you who are looking for what's going to be on Hot Topics for January, we will have something and it's to be announced, but we'll figure it out.
We will figure it out.
We are very good at figuring these things out. So I do appreciate everyone who shows up for these. And Doug, again, amazing, wonderful. And I'm so glad that you were able to make it.
Yes, me
Thank
too.
you.
Glad
I
everything
appreciate
is
it.
well.
Yes.
I'm going to sign off, y'all. Have a great one.
Thank you. Thanks, everyone.
Merry Christmas.
Happy holidays.
Thank you.